Recording. Okay. Good afternoon, St. Helena community. I'm Mary Lou Wilson, the superintendent. I have with me here today our district nurse, Kate Scudero. Kate, thanks for joining me.
My pleasure. Happy to be here.
Good. So we're coming to you today with some important messages. As you know, over the course of the pandemic, we have been using the California Public Health and Napa County Public Health guidelines as the measure to ensure that our students and our employees can be safe here at school. And over the past number of months, we have been conducting contact tracing, which has been individual in nature, and it's for close contacts. And you've received messages and information if your child was a close contact, and you gave us permission to test them so that they could stay in school in a modified quarantine. Of course, if someone is COVID positive, they've been staying home until those symptoms have been gone and they've met the quarantine isolation requirements. Last night, we received a new guidance from California Public Health, and although they are effective now, we need to unpack them and we need to understand them. And so we will implement them Tuesday, January 18th. January 18th, correct, Kate?
Correct. It's the 18th.
Okay, January 18th. So Kate, can you tell us about this new process called group tracing?
Absolutely. So group tracing means that instead of reaching out just to the students who are maybe in very, very close within the within 6 feet for over 15 minutes, it means that we're going to look at the whole group in the physical space that was exposed to that student who has since tested positive. So that means that we're going to be reaching out to more people because this new variant is a bit more transmissible. So we will be reaching out to the entire classroom or an entire sports team or whatever group configuration that the student was in, so that everybody within that group is aware that there has been an exposure. And then the follow-up to that is we will be notifying everybody and then doing some group tracing and some group testing.
So Kate, whether you're vaccinated or unvaccinated, the family will be notified that a child's been exposed?
Everybody in the classroom or sports team, everybody will be notified.
Okay. And that's likely because there are some breakthrough cases and students who are vaccinated are showing positive COVID tests.
Very true.
Okay.
Yes.
So then, much like the modified quarantine before, all exposed students, whether they're vaccinated or unvaccinated now, can continue to participate in school and extracurriculars, correct?
Yes.
So that is a little bit different. That's
very different, yes. And so now we have a modified quarantine that once we've notified people of their students' exposure, and we have consent to test those students, those students participate in a testing program at school. And once tested, they can continue and participate in the school day. They can remain in school provided they test negative, and they can also participate in extracurricular activities, and that includes Boys and Girls Club.
And just to confirm, you said that's for vaccinated or unvaccinated students, so all students.
Vaccinated and unvaccinated, that's correct.
And if a parent doesn't want us to do the testing, then what happens with that child who's been exposed?
If the parent would prefer not to have the school do the testing, the parent may come at the time of notification and take their student home and have them do a quarantine at home. That would be an option. Quarantine is now a bit shorter. The modified or the standard quarantine is going from the date of exposure for 5 days, with the quarantine ending on the 6th day, the return to activity on the 6th day. But during that time, we would be testing the students at school. If the parent would like to not have the students participate, then they can have their students remain at home for the quarantine, or they can have them test at home and give us evidence of that test.
Okay, so our goal is really to keep everyone in school, and so that's why we would offer the testing here.
Absolutely, we definitely want everybody here.
Okay, and of course, if they're going through that testing and they test negative, they are able to stay in school. What if they're exhibiting any COVID-19 symptoms?
If a student is exhibiting a COVID-19 symptom, they will be sent home to do testing outside, and if positive, they will remain in isolation at home. If negative, we would just need to be able to see the rapid antigen or the PCR results, and then they can return to school once their symptoms are resolving, because kids do get sick outside of COVID, although we tend to forget that these days. And we do want to just continue to maintain a safe environment. So if your student is home with a fever that's not COVID, we would prefer that fever resolve before they return to school.
Good. Yeah, exactly. So then also with regards to COVID positive cases, the isolation stay-at-home requirements have changed, correct?
They have that. So the isolation requirements for students who, and for everyone who is COVID positive, have been shortened. And the isolation period, strict isolation, is 5 days. If the person on day 5 tests negative, and at that point they're going to want to use a rapid antigen test, because if they use the PCR test, that is more likely to come up positive, to remain positive. So using a rapid antigen test to retest on day 5, after you have been diagnosed as COVID positive, a negative test on day 5 means you may return to activity on day 6. If on day 6 you continue to test positive, you would remain at home. The length of an isolation time remains at 10 days, sort of the early dismissal from isolation is if you can produce a rapid antigen test result on or after day 5 at any point between day 5 and 10.
Okay, and this is super complex. There's lots of pages to this guidance, and as always, those will be posted on our website, and they'll also be linked to this video for if somebody has questions. So as a community and a school district, I do want to thank all of our students, our employees, and our parents for continuing to follow all of the health and safety protocols we have in place. We do have a number of them. They are posted on our district website also if you want to take a look at them. They are aligned with CDPH, and we will continue all of that. We need you to continue to do a health checker every morning for your children before you send them to school. We need to continue to wash our hands diligently, and we need to continue wearing masks. Now, there's a little bit of a change with mask wearing. Kate, you want to tell us about that?
There is a change with mask wearing. To begin with, any mask is better than no mask. And so masking is required at school, and it has just been shown that reduces transmission of those respiratory droplets significantly. So while we were wearing our cloth masks for a long time, the research has shown that they are not quite as efficacious as the surgical masks. So we have the surgical masks, and these are just the paper masks. Whoops. The paper masks that fit with a little wire, and they fit around the nose. We have plenty of these on our school campuses for students who don't have a mask. We have plenty of these. The Department of Public Health is recommending that we even use a higher grade mask, the KN95 masks or the N95 masks, which are the more fitted masks. And they're a thicker mask, and they've got the wire around the nose, and they conform to the face a little bit more, just keeping that the respiratory droplets more contained. We are ordering these for our students, waiting for them to arrive. We didn't have them, and so we're ordering them, and they will be here soon. These are the recommended masks. In the meantime, there are some other options that we can use to better protect ourselves with the masks that we have while waiting for the KN95 masks to arrive. So the cloth mask doubled up with a surgical mask underneath it, as Dr. Wilson is demonstrating right now. That is an option that would work. I know some kids like to have their special masks that they've been wearing with their favorite characters on them. But a surgical mask underneath is adding that extra layer of protection. If you want to be a step up from that, you can go with the surgical mask and then another one. You can wear 2 surgical masks. And that just thickens the number of layers of protection that we have on to contain those droplets from shedding and sharing. And then the final, the one we're waiting for and that will offer the greatest protection are the KN95s or the N95 masks.
Thanks, Kate. And those I do have I can tell you that they have been ordered and they are in transit. So we'll get those to our students as soon as possible. And a reminder again, we do have plenty of the medical grade masks, so students can be using those on a daily basis. Kate, thanks so much for all of the information you helped with me to share today. If you have questions about any of the new guidance, feel free to contact me. Also, next Thursday at 4 o'clock, we will be hosting a webinar with live Q&A. So if you want to join that webinar, you can ask questions there. We'll also record that webinar and post it to the website if you're unable to attend. Okay, so there's items linked to this video and lots of information. Watch it again, wash your hands, wear a mask, take good care. Kate, thanks again.
Thank you.